We have now got the results of the second sero survey for SARS-CoV-2 infection. So now, what is a sero survey? Blood samples collected from general population are tested for IgG antibodies. Now, if a person has IgG antibodies positive, it means they have got exposed to SARS-CoV-2 at some time in the past. Now, how much time in the past is still work in progress. We are still learning. It's only a 9-month-old virus. So how long the antibodies persist still remains a question, but they start appearing after 2-3 weeks and then continue to be there for a few months. Now, sero surveys are supposed to answer several questions. What is the percentage of the general population has been exposed? What age group has been exposed? And what are the areas where we need to become alert from the public health perspective in terms of containment measures, in terms of identifying where there is the higher prevalence, so we need to be more active. Next, please. So the first sero survey was conducted in May 11 to June 4, 2020 in 700 villages, wards from 70 Indian districts. And this was conducted among adults more than 18 years. And overall prevalence of infection was found to be 0.73%. And you can see the confidence intervals are written there. Next, please. The second survey was slightly changed in the sense that we thought that younger individuals are also getting affected. So we said that we will estimate the prevalence among individuals above 10 years of age, not 18, above 10 years of age. And that the survey was conducted in the same 700 villages, wards in urban from 70 districts and 21 states, the same which were covered. Obviously the households were different, individuals were different, but the districts were the same. And this was conducted from August 17th to September 22, 2020. And you collected the socio-demographic details, the history of respiratory symptoms. We took a written informed consent and ethics clearance was taken, and 3 to 5 ml of blood was drawn from these individuals, and the blood was tested for Ig antibodies using the IgG assay. Next, please. So 29,082 individuals were studied, and the prevalence in individuals above the age of 10 years was 6.6%. So from 0.73% it has gone down up to 6.6%, and the prevalence is not different by age group or gender. However, we clearly found that the urban slums were 15.6%, and urban non-slum was 8.2%, whilst the rural areas were 4.4%. And the prevalence, if we just compare with the adults more than 18, if we compare that from 0.73%, it has now become 7.1%, the prevalence. So what is very clear from this second sero survey is typically one sero survey is not good to answer any question. You have to do serial sero surveys in the similar districts to find out what is happening. And so this clearly shows that the lockdown and containment measures as well as behavior change at the population level has contributed and checked the spread of SARS-CoV-2. However, a large percentage of the population is still unexposed, and susceptibility to getting SARS-CoV-2 exists, is real, and therefore we have to continue with our measures which the Health Secretary has pointed out. Risk in urban slums is twice that of non-slum areas and 4 times that of rural setting. And 26 to 32 infections were reported per case diagnosed in August, as against 81 to 130 in May, which underlines that the testing tracking and treating strategy has been implemented tremendously. Thank you. Now, this is a comparison of what some sero surveys are available in the country from Delhi, Bombay, Ahmedabad, Chennai, Puducherry, Indore, and we can see the Delhi within the last 3 months sero survey has been done in June, July, August, also in September, and it is not increasing much. It is 23.5 or 24% to 29%, and the last one is saying that it was about 32 to 33%. Ahmedabad is 17%, Puducherry is 4.9, gone up to 22, Indore is 7.8%. Next, please. And if you look at the international figures also, the latest one has come out from the US, which is still under 10%. It remains at 9.3%. Spain is 4.6%. United Kingdom is about 6.9%. And the highest is probably in Iran, which is 22% at the moment in terms of the country prevalence. Rest of them all are below. So the main conclusions from this Sero survey are that 1 in 15 individuals aged more than 10 have been exposed to SARS-CoV by August. Seroprevalence was not different by age or by gender. So it does not, all age groups above 10, we have found that it is there. Earlier we were under the impression that below 18 it does not affect, but we found now that there is no difference. Risk gradient is more, urban slum is highest, that is 15.6%, compared to urban non-slum, that is 7.6%, compared to rural areas, which is about 4%. And though, as I already stressed, that the increase in testing and detection has occurred. Now, since the last point here I want to emphasize is very important, since a large proportion of the population is yet susceptible, prevention fatigue has to be avoided, and we have to stick or adhere to our 5T strategy, which is test, track, trace, treat, and use of technology, which is Arogya Setu or Itihas app have to be used. And the non-pharmacological interventions like physical distancing, use of mask, hand hygiene, cough etiquette are still essential and continue to remain essential. Even after the vaccine has come, these will still continue to remain essential. And people-centric and risk-focused interventions have to be done more in urban slums, then urban non-slums, and then in rural settings. And as has earlier been pointed out, that elderly individuals with comorbidities, pregnant women and children have to be protected. And more important, the last point is that in light of the upcoming festivities, in light of the winter season and mass gathering, containment strategies must be implemented by the states most effectively, and the use of mask cannot be underlined more than after this Sero survey, that it is very, very essential, that a large population still remains susceptible, and we need to continue with these preventive measures.
अगर आपको हमारे वीडियोस पसंद आए तो प्लीज़ लाइक करें, सब्सक्राइब करें और शेयर करें।